Hey everyone, this is Rahil. This is my blog 3 post. For question 1, first I took the leadership skills questionnaire and the results showed that I was in the very high range for administrative skills score, the high range for interpersonal skills score, and moderate range for conceptual skills score. After analyzing the results and using the skills listed in our book, I would focus on planning, organizing, and directing in order to secure staff for my unit and other resources I would need for my unit to operate efficiently. Of the 3 skills from the book, planning is the most important because planning allows for you to analyze the situation. It allows you to foresee potential obstacles that might need to be addressed. And finally, it allows you to develop possible solutions for those obstacles prior to actually having them happen. By completing these 3 things involved in planning, it would allow me to have an upper hand and be able to secure needed staff and other resources before other units could get to them. The book listed 3 different types of planning. I believe I would select the standing planning type because it allows you to organize time and activities of the present. Next skill I would focus on is organizing because in order for my unit to meet objectives and goals, there needs to be a well-organized approach in accomplishing these things, which includes acquiring the appropriate amount of staff and resources. This organization would allow for staff to know what activities that they are assigned to complete in order for organization to be successful. And if the staff feels that they need additional staff or resources, then I can address these issues then. Finally, the skill of directing will be utilized in order to ensure the unit has enough staff and resources to get our work completed efficiently. And if things are not getting done, then I can hire more staff to help accomplish our goals. For question 2, I will use published literature to my advantage by providing evidence-based research about needing safe nurse-to-patient ratios in order to provide the best care possible for our patients. By providing this published literature, I can use it to secure the staff I need for my unit and the resources I need for my patients. The published literature also proves how safe nurse-to-patient ratios reduce patient mortality and reduces stress on nurses. For question 3, there are multiple levels and departments that I would need to work with in order to be effective in my role, which starts with my team that I'm leading. The productivity of my team is what will define me as a successful leader or not. In order to secure resources, I will need to work with human resources if it is staff that I need, but if it is material resources, I will need to work with the budgeting department to ensure that they have allocated enough funds to meet my needs. I will also need to work with other leaders and managers in order to identify strengths and weaknesses in my leadership skills, and they can help give me suggestions on how to better my unit. Finally, I will need to work closely with my supervisor in order to ensure issues that my unit is having with getting resources can be addressed, and ensure that my unit is operating to their standards. For question 4, I have a preference for a vertical structure model, mainly because that is how my current place of practice uses, and I have seen the effectiveness of this structural model. The main issue I see with the horizontal approach are that managers are spread thin and they're not available to solve issues and answer questions. As the vertical approach, I personally like having a chain of commands to follow in order to get an issue resolved and having my manager readily available to answer questions and provide knowledge when needed about policies and procedures. I feel the vertical approach is better because the people in management have less people to oversee and can focus more on ensuring the organization as a whole is functioning efficiently. Thanks for listening. I have attached my article about interdisciplinary nursing model below in the comment section. Thank you.